help FA try to develop a new version of the medical director's handbook and also try to create a new vision for EMS, especially for FEMA and for the USFA, the next 5-year strategy. And then I ran into Mr. Patrick again at EMS World, and even hearing about, I mean, where is EMS going in the long run? We know that CMS doesn't want us. We know that NHTSA doesn't necessarily want us. So where are we going to go? How are we going to forge our relationships as a EMS profession that includes fire, hospital-based, private, third service, so on and so forth? And so I am actually really excited. I don't know necessarily if Mr. Patrick's going to be addressing some of that today or not, but I think we have to be keeping our options open and being optimistic about where EMS could go in the future. I'll turn it over now to Mr. Chief Patrick, and it's all yours.
Hey, well, good afternoon, everybody. Thanks for the opportunity to join in on your conference today. And I know it's titled the Financial Symposium, and I certainly will talk a little bit about some grant funding. But beyond that, I'm going to leave it up to the experts probably in the room there, or I think you've already heard from one of our great national experts, Matt Zavasky, on some third-party reimbursement type of topics with that. But Tim, thank you very, very much. It is always a pleasure to work with and call colleague and friends, people like yourself, and the great mission that all of our EMS colleagues do around the country. I was just talking to Sean a little bit, Sean Caffrey, just before we officially signed on here. And Sean and I go back, maybe I shouldn't say decades, but it literally is decades. And he knows that in a previous life, I found as many excuses as I could to visit the great state of Colorado. For the great people, the topography, and just about everything else. So, and not to mention that my wife used to live in Loveland. So, but nonetheless, thank you for the opportunity. You know, when we talk about emergency medical services, and of course, there's, you know, depending who you talk to, anywhere from 5, and I've heard as high as 7 delivery models for EMS, and certainly the fire service is one of them, and one of the largest with that. But EMS at the United States Fire Administration is nothing new. If one were to take a look at America Burning, which is the creation from a early 1970s document, and I'm probably predating a lot of the people in the room with that, but America Burning was the creation of the United States Fire Administration, but that document is riddled with medical care and first aid references. The term emergency medical services still didn't really hit the level that it did later on in the 1970s, but nonetheless, the medical care aspect and frankly, the work done by the National Institutes of Health were all born out of America Burning with that. So if you fast forward through time, you know, one of the larger areas surrounding EMS and not having perhaps the level of recognition at the U.S. Fire Administration basically comes down to funding and resources with that. And that kind of spins even more fast forward to 2008 when the USFA received some statutory authorities for emergency medical services. And I'll talk about that here in a little bit, just to kind of paint that picture. And then I'll tell you why we are where we are today and what we're doing, why, and where we're going, hopefully with your support and assistance, because everything we do at the United States Fire Administration is for the boots on the street. You know, from the EMTs and EMRs and paramedics to the firefighter and the whole prevention model of trying to keep situations from occurring in the first place, whether it's fire or anything related to community risk reduction, which totally encompasses, you know, everything that we do in our profession of public safety, public health, and, you know, where public safety and public health intersect, that's called health security. And that becomes another part of what we focus on in the realm of Homeland Security, where the fire administration is housed. You see on the screen in front of you, the tagline of what really is our vision, the prepared and resilient fire and emergency medical services, because it is you in the room and all of our sisters and brothers across the country that essentially are the leaders in all aspects, from the prevention through the preparedness, response, and recovery aspects of that. And that's where we focus what we do in totality with it. So, and if you have questions as we're going along, please, you can feel free to I guess, raise your hand on this system, or through Kim or Tim. You can ask them, or we can address them at the end. But because I'm going to go kind of a little, in a pace here, just to make sure I get some, I think, information that both Tim and Kim had asked me about, and I share it with you. And Tim just hit a bunch of them right on the introduction, and I will touch on them as we go through. But my goal isn't necessarily to get through the slides. It is more importantly, I think, to address, whatever questions that you might have. What you have in front of you right now, though, is the overarching org chart of the United States Fire Administration. And as you can see, there are 4 divisions with that. Most people in our industry, if they were to even think about the U.S. Fire Administration, they typically think about the National Fire Academy, and as I like to call it, the National Fire and Emergency Medical Services Academy. And I'll tell you why coming up in a little bit as well. And obviously, the academy gets a lot of optics. People in the room, I can't see everybody there, but some of you may have been there already. I, throughout my career, have taken more than I think it's like 14 courses there over the course of my career with it. But the other 2 divisions that are there, the National Fire and Emergency Medical Services Division and the National Fire Data Research Center Division, fall under my directorate right now with it. And although the focus primarily of this presentation deals with the emergency medical services part of that, I just wanted you to have a kind of a lens on all the other aspects that the U.S. Fire Administration does that's outward facing for the first responder community. So EMS, it's something we are building out formally after decades. Right now, it's like building an aircraft in flight, and frankly, it's a fleet of aircraft building while they're flying. We'll come back to that. Prevention across the board, which links to not just fire, but EMS and all community risk reduction, and special operations. And what that is it's a catch-all, so to speak, but we are also the connection for fire and EMS to FEMA, the Federal Emergency Management Agency. And we staff disaster response desks during major types of disasters, representing fire and some EMS with that. And that's where these people are typically housed in this particular branch of my division. And then our communications branch is the public education and all the social media stuff that we do. And then, of course, if you are in the fire service part of EMS at all, the National Fire Data Center, or NFIRS as it's known, is housed in my shop right now, as well as all the research we do for fire and emergency medical services across the board. So again, just giving that kind of 50,000 foot view of the USFA. This is the Fire Prevention and Control Act from 1974. This is what I referenced when I said America Burning created us. That's when we were created in 74, and it lists just some of the key areas in there that are called out in legislation. And for this group, probably most importantly, EMS in 2008. And in 2008, when that was called out, we got some appropriated funds to start creating emergency medical service related education programs. And I'll highlight a lot of them on a slide here coming up with that. But I think it's important to know that that there are over a dozen EMS programs at the USFA that are academic curriculum. Most of them are post-collegiate, if you will. Some are even post-grad. None of the EMS ones have a requirement for any of that, but that's the level of leadership type of executive programs that we develop and teach in the National Fire Academy as a whole. And over time, unfortunately, there were no other resources. So what manages to be built out and updated is what we have. There's only one person who is dedicated as a full-time employee to the EMS side for the Fire Academy. With that, that's about to change here in the coming years, but that's just setting the stage for what we're doing and where we're going. You know, if you take a look at Hotfoot, that's our logo, the bird at the bottom of the slide. With that, if you'll notice right above the eagle are 4 stars. And essentially, the 4 stars are the first 4 bullets of the key initiatives that are on the screen there for you. So public education and information, that's also linked to prevention. These are just the words that they used in the legislation. The next one, training and education, then data collection, and then research and technology. And we are actually looking at adding a 5th star to capture EMS in our logo and obviously in the messaging that's going on here right now. And this is one of the reasons that I'm here to talk a little bit when Tim asked me about doing this and sharing some information with you. So on the screen, that pie chart, you know, the most important thing that should pop out at you is the green aspect. And this is the evidence-based, data-driven snapshot as to why we are stepping up even more as the number of incidents responded to in fire departments all across America are increasing every year in EMS for it. So based on the NFIRS, the National Fire Incident Reporting System data, 65% of all responses by all fire departments in all of North America, our U.S. territories, and our tribal entities are for emergency medical service related type of incidents. And there are many areas, urban and suburbia, where it's as high as 90 to 94% are EMS responses. So in order to address that, there are a lot of challenge and opportunities across the country in fire-based EMS alone, relevant to what I just said. So one of the parts that we're doing is working on what's called a needs assessment to better understand where the gaps are in that arena. And then we will decide whether they are federal responsibility and then rack and stack them to start attacking and addressing rather which ones of the gaps we can best handle in strategic order. That being said, as you all know, at the end of the day, EMS is about patient care and patient care outcomes, and delivery model is just that. It's a delivery model. So my lens is that whatever we do in emergency medical services is to help all of our colleagues understand to not try not to get hung up on the word fire where it appears. You know, statutorily, you know, there's many reasons we have to use the fire. There's many logical reasons with it as well. But at the same aspect, you know, emergency medical services in relationship to patient care, the delivery model shouldn't change that. So we're very cognizant of that as we go forward with what we're doing. Just a few more numbers on data. This is last year's data out of 23,000 plus departments that have reported to NFIRS. Keep it in mind, there's roughly 29,900 ish fire departments in America. So not all departments report into NFIRS. It's a voluntary system, and there's a number of reasons why some departments don't with it. But at the same time, when we promote and talk about all the data and do the statistical analysis and reports, there's a comprehensive estimation methodology that we leverage in cooperation partnership actually with the National Fire Protection Association to give a pretty true number to the actual percentages and hard numbers that we pump out. But you can see there it says on the 2022 that 90.1% of fire departments said they responded to EMS incidents. But when you get into coding and calculating as to or deciding what a call is or not, that can skew those numbers, with it. But it's still pretty high, regardless. So with in 2022, toward the latter part of the year, the U.S. Fire Administration went through a reorg with that, and in the reorganization, which was approved, and we were authorized to start doing it on January 1st of this year. We started to realign resources of people and some money, and building out this EMS branch that's referenced up here. And right now, this is the high-level vision statement and mission statement to what the branch within my division is focusing on. And yeah, they're big words, so to speak, and very broad. But at the end of the day, we want to assure that what we're doing is what you want and need, most importantly, across the board. There have already been existing lists collected within the federal government that I would call gaps solely in disaster preparedness and response and representation of EMS at the federal level and in many, if not most, states across the country with that. So those are some major areas that I will highlight here coming up that we are focusing on. Right now, this branch has 5 full-time personnel with it, and we are in the process of hiring another person. We have requests in through the federal government budgeting process for quite a few more of people in expertise in EMS and the practice of medicine as well, and a lot of money to hopefully support the gaps that are identified to start closing them over time. So in the aspect of fostering the pre-hospital, or frankly, I should have changed this word because it's the out-of-hospital system of medical care provided by emergency medical, fire-based medical, whatever, even hospital-based systems. When you start to think about community paramedicine and mobile integrated health and things like that, the word emergency doesn't apply with it. So our new tagline is the out-of-hospital systems, but it's that equitable and effective systems across the board that we want to ultimately enhance. And there is some transformation that has to occur with a number of these aspects, especially in the all hazards response, even knowing that you're available or eligible to respond. But once you respond, getting reimbursed is critical. And I know that's a major issue. COVID brought that to the forefront like nothing else probably has in most of our lifetimes. So these are the areas that, again, at the 50,000 foot view, we are focusing on. None of this is on deaf ears either. And it's one of the reasons why this is probably the maybe 10th or 11th presentation like this that I've had the opportunity to give just in the past 6 months as we're doing this. And what this slide in front of you is speaking to, this is from the FEMA administrator. The administrator, Deanne Criswell, issues, and every FEMA administrator does each year, what they call a calendar year annual planning guidance for all of FEMA. This year was the first year ever that emergency medical services was specifically called out. And those 2 bullets are 2 bullets right out of the narrative that charges the U.S. Fire Administration to work with FEMA to address for it. So what's this mean? In a nutshell, just what I referenced. It means community lifeline recognition in the National Response Framework for Emergency Medical Services. If I were in the room or if I had a better picture, I think on my screen here, if I was a little more tech savvy, I'd probably poll you and ask you to raise your hands if you're even familiar, or if you are familiar with the National Response Framework and community lifelines. But I think the bigger question is, and Kim, I can see you. I don't know anybody else in the room, but maybe you can even shout out if I can hear them talk. Do you know where um, EMS is in these community lifelines by chance? Anybody?
Sean? I do not. Apparently we do not.
Okay, no, that it's fine. It's fine. You know, I'll send the test scores later, and just kidding, my friends. But no, seriously, it's under transportation with it, and it's listed solely as an ambulance and solely for transportation purposes. And this is something you should care about because it directly relates to the reimbursement during disaster response, or should I say the lack of reimbursement during disaster response for ambulance services. It's not that the ambulance transportation part of it shouldn't be in transportation. We don't want to take it out, but we need to identify in the other, what they call community lifelines, the pre-hospital medical care that is provided, both, you know, treat and release as well as, you know, treatment in transport. And that might ring a bell to your financial discussions, whether you're doing third party, you know, reimbursement to what maybe Matt or others have talked about in some of your other sessions, to the need to get money such as from the CARES Act during COVID, which was one of the biggest complaints that we had heard back. So it's a great thing that this is in here. My team, self included, have been meeting with FEMA regularly on these topics, and the ball's rolling to start making some effective acknowledgement, and then enter into the whatever the bureaucratic process will be to make and affect some changes with it. But it's frankly to get the fair amount of money that's needed for the preparedness and the response, coupled with the recovery for it. So, and again, I know I'm covering a lot of stuff. So if there's questions you have, and if we do run out of time at some point here, Tim for sure, well, and Kim know how to get a hold of me. I'm certainly happy to respond to any questions after the fact if we don't have time for any of it or for all of it today. So as we work on addressing that, because keep in mind, you know, I have 5 people, one of them's a staff assistant. So that means I have 4 subject matter experts. And in their subject matter expertise, you know, we got a lot of buckets of things we're working on. But what I just spent the last few minutes talking to you about is number 1 on our list, because we have heard this loud and clear. I used to say it when I was in operations back in the days with Sean and others around the country of dealing with fair equity of grants and funding and reimbursement through FEMA and representation of EMS. But I think what's going to happen here in the not too distant future, at least I'm really pushing for it, is to get EMS a greater seat at the table in the federal government for disaster operations. So that being said, some of the key initiatives that we are focusing on with these resources build from that. I already spoke a little bit about this EMS needs assessment. I just was told yesterday that I can expect the final deliverable from the contractor next week. So I'm excited to get that information for it. I've seen some preliminary information, and many of all of the national organizations that represent EMS served on the technical expert panel that developed this needs assessment, which is a report to the United States Fire Administration specifically. So I'm excited to get that because that's going to help us really frame what this technical expert panel has heard from people like yourselves across all the states and territories with it. I won't spend any more time on the National Response Framework and Community Lifelines because I just talked about that a little bit. Another big area is the EMS Licensure Compact, or it's called Replica if you are to Google it and take a look at it. But that's for the interstate portability of pre-hospital medical licenses during disaster response or other types of special operations with it. One clarity piece forwarded. It is not about moving from Colorado to Pennsylvania and keeping that license there while you're going to work there permanently. That's not what it's for. With it, it's for us to be able to deploy us as a holistic government, whether it's FEMA and more importantly state to state, to assist in disaster operation, whether it be wildfire situations for medical personnel, 2, 3, 4 states away, to the hurricanes or other types of disasters. Right now, I think we're around 26 states in the nation have constitutionally or changed their state constitutions to adopt the EMS compact with it. But one of our goals is at the USFA is to get FEMA well versed on this because it's been a long discussed topic, and we want them to help leverage the support for all the states that are not yet in the compact to get them on board for the ultimate purpose. The federal initiatives in FICOMS. If you're not familiar, FICOMS is the Federal Interagency Committee on Emergency Medical Services. For somebody, if you haven't been involved or around the federal government, be like, what's he talking about? What is this? Well, Tim said this in his opening comments. Where does EMS belong in the federal government? And I can tell you, I could probably ask each one of you in the room privately what your thoughts are for the EMS in the federal government, and I'd probably come away with a dozen or a couple dozen different opinions and thoughts. None of them necessarily wrong, but at the same aspect, the point here is that's why FICOMS exists. So under federal statute, there are 16 federal agencies across a multitude of departments like Homeland Security, Department of Transportation, Health and Human Services, Department of Defense, Department of Justice, Department of Education, and the list goes on and on and on. So there's 16 agencies that are federally charged to collaborate and coordinate their work on emergency medical services. Goal 1 is to assure that each other understands what the other is doing. And goal 2 is so we don't duplicate it or replicate it, but that we work together with it. It works pretty well in just that realm, but what it also could do is answer a lot of the bigger questions and provide perhaps the bigger resources that EMS has been asking for a very long time, justifiably. The reason it doesn't, it has no resources. It's never been funded. So there's been no appropriations from Congress. There's been virtually no lobbying or congressional education relevant to it, because keep in mind, feds, we can't do that. What I'm saying right now, I can't go to Congress and try to educate them or lobby. I could try to educate them, but I can't lobby for this, for it. But the point is, we have a system that actually works. It's just not resourced. It may not be perfect, and many of us can debate different angles of all of that. I too know of certain things in my own lens, and I've been involved in FICOMS for more than 25 years with this. But we are making some progress now where stars are aligning or are aligned in the U.S. government, which is why you're starting to see maybe more activity for EMS and on the fire service side, because the support is there from the U.S. Fire Administrator to the FEMA Administrator to the Secretary of Homeland Security to the Secretary of Transportation, DOD, and the like. So there's a lot of connectivity that's starting to rock and roll. But that's the structure that exists right now and likely for the foreseeable future. But I just wanted to share a little bit about that. And then the research and technology part of this, we're really starting to get involved in more EMS research, whether it's our own people doing certain aspects of research, or more likely taking collective money across the Fed to address some type of EMS research that needs to be done and support that through money and all the contract work that has to be done. We do extensive amount of this work for the fire service right now, hence who we are, but we're stepping up to do more on the EMS side of the house as well. When you look at what the USFA has to offer, and I'm not watching a clock, by the way, Kim, so feel free to give me a 5 or 10 minute warning or something when I'm hitting the mark. Thank you. What you see on the screen here, this is pretty much stuff right off of our website. And when I get to the last slide, there'll be a QR code that you can just click on, and it'll take you right to the USFA's EMS page. That this isn't everything. This is just some of the core products that we have out there now. Many of them are in, and you can see like the alternative funding for EMS and fire. Its 3rd edition says awaiting for release. I actually have it up on my computer right now with it, the final document. So I'm waiting for the green light that it has been posted on our website, and we'll be blasting that out through social media and every other conceivable angle. And I tell you that because the funding manual is the #1 first responder document asked for on Capitol Hill in Washington, D.C. Typically, every U.S. senator and representative in the House gets a copy of this manual because, no surprise to you, it's probably the #1 or #2 question they get from you or from our own stakeholders, right, across the country, which is the second test. So if EMS is, I'm sorry, if funding's #1 or 2, what's the other #1 or 2?
Recruitment.
I heard it. Whoever said it. Recruitment and retention, or retention and recruitment, depending which way you want to look at it. And we just released our updated document on that. It's live on the website. That went up about a month ago. I see I need to update that slide with it. But again, critical aspects that help us on a daily basis. We do a lot of work on EMS safety, on fire safety, on vehicular response safety, on what ambulances look like, to fire engines as well, from painting to lighting and warning devices type of things. So there's a plethora. Some of them aren't even on this screen. Tim made reference to the EMS Medical Director's Handbook that he's involved in. The 2nd edition of that is currently working its way through our bureaucratic review process, which takes several months within the federal government. But I hope to get that out the door before the end of the calendar year here. And one of these unfortunate situations that we're seeing happening every day, and civil unrest, or not every day, but more and more daily, is civil unrest, active shooter, our friends and colleagues across the board in the state of Maine, just yesterday, to ring a bell, things that we work to address. Some more on these topics popping up on the screen here. The ongoing studies where it's saying that these are projects that are currently under contract with a third party business. It could be an organization like NAEMT or the International Fire Chiefs, or it could be a mom and pop organization that does business with the federal government that has the subject matter expertise. But they are building out all of these programs. So sometime in the latter part of next year of 2024, these documents will be available and released for your use with it. So that was to kind of just demonstrate some of the work that we do with that, excuse me, at the USFA. At the Fire Academy side of the house, this is the academic side for doing education and training. Tim, I don't know if you could tell me, but in the room, how many people, has anybody been to the Fire Academy? Hands, idea of how many? Anybody?
Two.
Okay.
I haven't been yet.
Okay. Awesome. No, two's better than none in the same aspect. Trying to get the word out, even more. One of the things, if you see on there's different ways we deliver these courses. In person, coming to Emmitsburg, Maryland is one of the more popular with it because it gives people a nice getaway on a college campus environment. And yes, our facility, government facility, is an old St. Joe University or St. Joe Women's School. Sorry. college campus. It's what the government and the government bought it. But nonetheless, we do state programs. So there are state delivery programs for the National Fire Academy curricula, and we also have a whole virtual program as well. But one thing to know for EMS with that is all these classes we offer in emergency medical services. And it's one thing that I know the Fire Academy recognizes that they have not done a great job over the years to advertise the EMS courses themselves. It doesn't mean that we don't get a lot of people take the classes. We do, but we certainly have more space for that. And the only cost for most people coming here is the meal ticket, because the government pays a stipend to cover the travel. And because it is a college campus, we have essentially dormitories all around the campus, food. It's a self-sustained facility for that. So here are, going over some of the major programs that the Fire Academy itself offers for EMS. The first time supervisor leadership competencies one, which is the first bullet on the screen, is brand new. It just ran a pilot program. I think it was back in June. And I know I personally heard accolades related to it. But when they run these pilot programs, they also have students evaluating the course, not just taking the course. And then, those evaluations are taken and then incorporated into honing the curriculum and associated services for the final product as it comes out for it. Management of EMS, the quality management course. It's one of the older courses, but it's one that I know in the feedback that the USFA gets from EMS personnel taking it, it might be number one on the accolades list for that curriculum. And I know they're talking about updating the program. Mobile integrated healthcare program management is one of the newer programs that's offered with it. And then flipping the screens, some more that are dealing along the line of, oh yeah, sure. Go ahead.
At one time, you were required, or only people who could apply for this were fire, and if you were just EMS, you had to have a sponsor from a fire department. Is that still the case?
Honestly, I don't know if that was ever really true in the past. I know it was a word of mouth out there, but to that being said, no, it is not the case. In fact, anybody can take these classes. The caveat comes in is to which one, what you might have to pay. And what I mean by that is, and unfortunately, I don't have that right in front of me here with it, but I believe for-profit ambulance services, for-profit fire departments, and yes, there are for-profit fire departments, fire brigades and things like that as well, have to pay. They can take the classes, so everybody can take the classes with it, but some people have to pay. There's even some federal agencies that want to send people or do send people to the classes, some of the fire and EMS classes, but they have to pay. It's just how the rules or laws are basically written. But I can certainly get you the exact explanation of that, ma'am.
Okay. Thank you.
Oh, absolutely. With it. So on the ICS classes, the incident operations classes, for those the couple that have been to Emmitsburg, Maryland, to the campus, if you didn't take these classes, you still might have gotten to see this on the tour. We have some pretty interesting and phenomenal what do they call it? Virtual reality rooms for running scenarios and incidents across the board for ICS and integrating integrated command and the advanced life support for hazardous materials is a pretty cool program. We've got those the mannequins. I don't know what brand we have, but they might as well just start talking to you and get up and walk, because they do everything else as well. But it's a pretty pretty interesting environment. The community risk reduction, that's a EMS integrated program with the fireside. It's one of the most popular programs. People come from all over the world to take the CRR program. There, one that's not listed here, but there are some EMS applications to it because arson investigation and related to that, the only live fire we do at the USFA, we have a burn center for part of the arson, and it's a tiered multi-year process to go through all of the arson classes, but it is the one that I believe the last I heard, there's a 2-year waiting list. That's how popular the course is. They do evidence recovery out. We have a place out in a field that has a wrecked vehicle and has buried bodies and buried other evidence and things like that. We have dogs for detection, from blood detection to drug detection, etc. We actually have a real courtroom. We have a real judge. We have real attorneys. And throughout the whole process of going through these programs, it teaches a fire marshal or somebody else with those investigative authorities, depending the topic, how to do each one of these types of things. It's pretty cool actually just to watch it happen. But we're looking at where we can put medical and EMS type of things into some of that as we go forward. Here's a list of 5 EMS programs that are under development right now and going through the processes of both beta testing and being built out. So this comes with some great support we had last year financially to be able to get these developed and built out. So they'll be coming out here in the, I don't know what takes a year or two. All of the classes at the U.S. Fire Administration are ACE accredited. So they meet the academic criteria for many different programs, from associate, bachelor, master's degree programs with it. So, and again, I'm not going to read the slides to you. If you have questions, you're welcome to obviously throw them out at me for that. As far as in the federal government, we have a lot of collaboration that goes on. This kind of links to what I was talking about, FICOMs. I mean, obviously it's there on the first bullet with it. The National Highway Traffic Safety Administration's Office of EMS, which is what one would call today the federal lead EMS office, is the parent for operating FICOMs. But under law, they have to collaborate with Health and Human Services and Homeland Security. And the U.S. Fire Administration is the Homeland Security rep to the FICOMs. So the 3 federal departments of DHS, HHS, and Department of Transportation are the overarching kind of umbrella parents of FICOMs with it. But the National EMS Advisory Council, which is made up of state and local people in the professions of EMS of every aspect, including most of the disciplines in the practice of medicine, so our physician colleagues with that. But NEMSAC meets several times throughout the year, and they write position papers and recommendations or advisories to the Department of Transportation on anything you can think about in EMS with that. And then the Department of Transportation can, use it, do something with it if they want or not, or pass it on to another department or bring it to FICOMs for further consideration and deliberation. I'll be forthright with you. There's one going on right now, if you're on social media and the EMS NGOs, that's dealing with degrees for paramedics at a certain level. Not all paramedics, but a certain other level of a paramedic, being required to have a degree. I'll let you do your own homework, on that, but just about every non-government organization that represents our profession has a position and paper on that, and they're floating social media as I'm talking to you right now with it. But that's kind of how this all comes together with NEMSAC and even FICOMs to go to the next level of deliberating over the topic, and we'll see where it goes from there. Some other key areas I just pulled out in the federal government with EMS is in DHS is science and technology. With that, that's a headquarters office of Homeland Security. From the Fire Administration, we work intimately with them on many different projects of fire and some EMS. I will tell you that there is an organization in the Science and Technology Directorate called the First Responder Resource Group. And the weakest link of that group, made up of people like yourselves, is our profession of EMS. The majority are made up by fire and law enforcement. It's actually law enforcement and fire in that order. And there's maybe 3 or 4 at the most in emergency medical services in our profession on a group that has nearly 50 some people. So anybody in the group here that may want to know more about that or have any interest can certainly contact me separately, and I'll link you up with the right people to get in there. The point here is we hear all the time about, well, we need this, we need that, we don't get this, we don't get that, yet we EMS aren't at the table with many of these. So I'm trying to invite you, or I am inviting you to the table if people are interested in some of these groups and organizations. The National Institutes of Standards and Technology, which is just outside of Washington, D.C. And near Frederick, Maryland, does a lot of research related to fire and emergency medical services as well. I literally, just this morning, was at NIST for a groundbreaking ceremony on robots in the emergency services and the technology that they're building for robot use by fire, law enforcement, emergency medical applications, et cetera, into the future. There'll be a lot more to come on that, but it was a national event for this ceremony, and they had a lot of high-level political reps that were there. But it's just unique that I get to talk with you a little bit here and share of how this stuff all works together to help us into the future of the profession that we have. And then on here, you have Health and Human Services. And the reason I have that there is the other parent of FICOMS is 3 major areas that I know at least the second bullet there is of great concern to this group or of interest from the, I'm sorry. No, it's not. I don't even have it there. Now I'm missing it. Why don't I have CMS in there? That's CDC. My apologies with it. Well, CMS is under there as well. And obviously they're the purse strings for the reimbursement for all of medicine across the board, not just Medicare and Medicaid. All the private insurance companies take their direction and lead from CMS, as you probably know. But these other aspects play vital roles in what we do in our profession as well. The thing called ASPR there, the Strategic Preparedness and Response, is all disaster medicine with that. So that group works hand in hand with FEMA on COVID throughout all of COVID as a great example, or any other disaster response. And there's a huge element of emergency medical services in all of that, all that operations. And then in NIOSH, that's the health and safety and the research that's done for all aspects of business and industry, but they have an actual fire EMS agency within NIOSH itself that works on things like cancer in our profession for fire and EMTs and paramedics, to PPE and all the positive and the negatives surrounding that. And they do the studies and provide research guidance on that. They also do firefighter line of duty death investigations within NIOSH. So winding down here, and then if you have some more specific questions, I'll be happy to address them. This is a list of most of the major alphabet soup organizations at the national level who represent us. I don't know, pretty much anybody other than maybe Sean's background in the room there, but many of you may fall under these groups, may even be members of these groups. But my point is that we have and we continue to work with all of them very upfront and letting them know what we're doing, why we're doing it, And we also obviously take input. We can't take direction, that's against the law, from it, but we certainly take the input from anybody in the industry to weigh into what we are doing. So with that said, if you are interested in more on any of the topics I talked about, or more things on emergency medical services in the U.S. Fire Administration, you can take a picture of that QR code and it'll take you right to the EMS pages on the USFA's website. So I'm going to pause there, Tim, and or I'm sorry, Kim, unless Tim's in the room, I can't see him. But Kim, I'll just go to you, and if you have any Q&A you'd like to chat about, we can go for it.
Any questions here in the room?
Yeah, I got one.
Yeah, Nick, go ahead.
So Rick, you were talking about how you've got a bunch of projects going on and you guys have outsourced to places like NAEMT to help you complete those projects. And you beat me to part of my question where you said right now there's a big debate going on about education for EMS providers. So clearly some of those groups, like NAEMT, have bias towards what they think education should be. What do you guys do to control for that bias in their reports and how it influences your organization?
That's a fantastic question. I would tell you that I'll tell you the way it works. You know, all these letters are and position papers. There's position papers with letters that are being sent to the Department of Transportation, again, as the viewed de facto lead agency for EMS in the federal government. And maybe more important than what I just said is the national standard curriculums framework for every level of an EMS clinician, right, comes from the Department of Transportation. That's where they were all built out over the decades for. So, you know, that's even a larger part why the letters of interest, the position papers and the like go to them. You know, I can't speak for them, but I can tell you how it works. You know, they'll take it and they'll analyze it, you know, themselves, and then have some internal discussions as to the validity and if it is the role of the federal government to even pursue that. There is a chance that the topic will be brought to FICOMS for greater discussion along the same line. But as things similar to this have happened in the past, typically what has happened is the government then creates a contract with some entity to pull together all the parties through what, as I referenced in like some of our contracts, called technical expert panels, or they might be called something else, but that's what we're talking about. And they pull them together, and we have discussions. We put the elephants in the room out there, and we come to mutual agreements on what should or should not be, and then we build it if it's something that's to be built. I cannot speculate and tell you that this will happen, you know, or it won't, you know, from the federal standpoint, but hopefully that's making some sense. I probably sound like a bureaucrat, but it is something that, you know, we can't just say this is what's going to happen, boom, 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 but this is how things happen. It's people speaking up through the collective bodies of the representative organizations. That slide I had up earlier, you know, these, in fact, I can just go back to it, you know, these types of organizations, and then some, as well as many, many individuals type of thing. So I don't know, you know, if you got another question related to that, but that's the best I can probably try to paint it for you.
Well, and I understand there is bureaucracy involved, right? It's the federal government. It's a big, hairy, often slow-moving beast. You know, a lot of the problems that you guys, I think, are trying to address have existed at the start of some of the careers of our eldest respective. Years ago, I remember seeing a video of Timmy working in an early Colorado Space Department, and they're talking about pay disparity between fire medics and stuff. I think it was you on the news that article. It's still there, right? And so when you guys are hiring these contracts to do stuff, you've got these folks that are very clearly biased or that are promoting things that are out of their lanes. Like recently, the whole heads up CPR suggestions promoted by clearly fire department fire-based places that don't do EMS and EMS research. How does that influence how you guys hire these contractors? Because I feel like it's very hard to remove that bias as a human from a report at the end of the day, which is, should be these EMS-driven things that we want to move forward that are often run by people that historically have not promoted EMS as their top priority.
Yeah, that your statement was riddled with a lot of potential questions and discussions. I'm going to separate out the head up CPR part just for a second and go back to the hiring a contractor. In the federal government, when you say like large turns slowly, one of the, I think, more important terms for all of this is deliberative. So, under the whole construct of the U.S. Constitution, it's deliberative. So in order to be deliberative, that's a slow process. That's to make sure that the lenses are coming in from every conceivable angle for any decision made before we, do something. And I'll give you just an example. When I did a fellowship on Capitol Hill as a federal employee. And one of the things I was learned from day one was the fundamental intent of the United States Congress is to assure that no bad idea ever becomes law. Think about that. And I'm going to leave it at that. I just want you that's the fundamental intent with it. But it ties into the question of whether it's this topic of degrees for paramedics to, anything else. But to answer the question related to the wrong people at the table, I would beg to differ because the contracts that are let on these topics require the contractor to engage at minimum a predefined list of entities. And those entities generally involve all of that alphabet soup that I just showed you on that previous slide, as well as all the other related disciplines, what the topic may be. Type of thing. So the meetings can encompass, dozens of people representing dozens of yes, special interest groups, but hopefully an offset balance with citizen representation sometimes, depending the topic, as well. So they're pretty well thought out before they're just developed. And of course, at the end of the day, the feds, have to be the ones, just by the way the rules and the laws are written, to, what's going to be the product that's finally, goes out the door, because the attorneys and everybody else are going to have their say as to, well, you can't say that, or you got to say it this way, or whatever the case may be. So I'll pause right there, and then I'll go on to the other part, though, is when you made the reference about the heads up CPR part, that was not a contract. That wasn't something we did, on our end. With it, certainly happy to have a little conversation with you separately, along that topic with it. But I do note, I think, your point.
Thank you.
Any other questions? Mr. Gaffrey, yes.
Yeah, thanks, Jim. Rick, I'm probably gonna ask you a little easier question. And I'm gonna take you to a different, one of your rectangles. I've heard conversation that the NENFRS data set and the MSIS project are having conversations about doing things together better. Do you have any comments on how that's going, or if that's just a crazy rumor?
Oh, no rumor whatsoever. Absolutely true. Excuse me. So I can tell you in a nutshell, the Fire Incident Reporting System and NEMSIS they can't even talk together. It's not a matter of wanting them to, they can't, just by the code and the design of how they're written for that. But we had been working for quite a while, the last several years, during COVID even, with NEMSIS folks on other ways to look at the data coming out of the fire data system and NEMSIS to correlate it and to tell better stories, if you will, as to what the data actually is painting a picture. So leave that there for a second. A year and a half ago, we started developing a contract and then actually let the contract to build an entire new system for NFIRS. It's called NERIS. It stands for the National Emergency Response Information System. National Emergency Response Information System, NERIS. That is being developed beyond the speed of government right now because we have so much support across the federal government side of the house. It's being built by FRSI, which is the Fire Research Safety Institute under UL, under Underwriters Laboratories, through a contract with DHS Science and Technology. So they are building this program. It's moving along pretty quickly. We expect to actually beta test the system, phase one of the system, in the next, I'd say, 3 months, if not by the end of this calendar year, in the early part of 2024. And then they'll continue to build out the program throughout 2024. And toward the end of 2024, almost this time next year, into early 2025, all fire departments in the United States will be switched over to NERIS. And once they're switched over, the NFIRS system will sunset likely toward the end of 2025 with that. So that's what's happening very dynamically. Built into this data analytics system is its capabilities to talk with NERIS both ways, as well as many other data sources through the API, through APIs themselves. So at that point, we will be able to accomplish one part of your question, and to be able to have a lot better data on all parts of EMS, regardless of the delivery model. One of the major hiccups with this, and it's been a NEMSIS hiccup as well, is CADs. There is no national standard, as you probably know, for a CAD, and that's critical to ultimate success overall in telling the story and painting the picture, which that is also being addressed. I do know that one of the pilots that's going to be run on NERIS is going to be run in the National Capital Region here in the DC area, because they all operate off the same CAD system. So it'll really be able to tell us that this new product will really do what it has been envisioned to do. So yes, it is true to what you're saying. The other part, I think, Sean, that might be built into your question, even though you didn't say it, is are we taking over NEMSIS? And the answer is there's no intent to take over NEMSIS. It's to work with an existing system to improve both systems and the analytics and stories of information that come out of them.
Any other questions for Richard? Online? I see no hands here in the room.
I have a loaded question, I guess.
Okay, one quick question.
More or less
Kind of ties into what Zuber was saying. So with the National Fire Administration getting more involved in EMS, what systemic pieces are going to be implemented to ensure that it doesn't become weighted to focus on the national EMS system becoming solely fire-based? Right? What institutional mechanisms are going to be in place to understand that the way that our system is built today, it's critical that other third service and other service delivery models are essential to delivering care?
Good question. Great question. I can't answer that question. Just to be forthright with you, we don't have that intent to do that. We're working to, again, as I started right off with, bridge and fill identified gaps that have existed for literally decades. That's going to take us a while to even tackle those with that. In the greater picture to where you're going with this, I'm going to fall right back to FICOMS. This is why FICOMS exists. Are we stepping up frankly, we're stepping up because we're getting resources to do something that the USFA has wanted to do for a long time, and they have the statutory responsibility and authority to do. I don't want to go down the authority lens, but now that we're getting the resources to fill gaps that have been identified through people and comments like you're referencing and those types of questions, to the list that FICOMS has over the years, to the best not best practice necessarily, but the position papers that NEMSAC has put out for things to address and tackle. We're stepping up. We have the opportunity to, and we're doing it. And one of the big goals I have is to have a dedicated staff member, at least one, working on FICOMS related work, which fundamentally, is really, I think, what your question is, ultimately about, because that's how the government works in order to do it. Important to know on what I just said, though, is there are no dedicated staff or money from any federal agency to FICOMS. And that's a fundamental problem of not being able to accomplish a greater unity, of this. We don't have the resources to run CMS, EMS related stuff, or DOT, EMS related stuff for transportation, or, defense, or anything, like that. Not just the resources, the SME. It's why we bring all those subject matter experts together at one table to decide, what should be addressed, what shouldn't be addressed as a federal responsibility, et cetera, et cetera. I know it doesn't directly answer your question. I can't directly answer the question.
Fair enough, thank you.
Thank you, Richard. Appreciate your time today. Thank you for speaking with us.
Well, before Richard goes, I just want to reiterate a couple things. I know that we all come from varying degrees of history. We all come from varying degrees of bias. Sooner or later, we're going to have to let some of those biases go. We can still go with our eyes open. But part of the problem with EMS is we've been going and we've been going and we've been going for years, decades, and we haven't really gone anywhere. I mean, we've made some advantages, but we haven't gone anywhere. And one of the things that I like, and I'm speaking from a different angle as well, because with my experience with the NAEMT and actually being in the room with some of these folks and hearing the level of engagement for all levels of EMS and how all levels of EMS are being incorporated into the greater plans and into the bigger pictures, I mean, I'm encouraged. Personally, I'm encouraged. Because, sorry, ringing in my ear, going to airplane mode. What I would ask is given an opportunity to see and make certain that we all have a seat at that table to where we can move forward, because private EMS isn't the best tool for all circumstances. Fire EMS isn't the best mechanism in all circumstances. And third service or hospital based is not the best mechanism for all for all areas. And I think they all recognize that. And so how can we work together? Because if we continue to fight with one another, if we can't go to Congress with a consistent message of what we need, and I've never seen the collaboration that we're getting right now from all the groups on all of our national issues that we have now. And that's because we're seeing that working together gets us farther than fighting each other. That's the bottom line. And so all I'm asking is for everybody right now to keep your options open, be willing to watch and accept some change. I think it could be positive for us in the long run. So, Mr. Patrick, thank you very much.
Can I just make a quick comment too?
Yeah.
First of all, let me point out, this is super funny, because I'm the fire guy in the room. And it was a long time coming around to that, but no, I just want to say, and I appreciate a lot of what Rick ran us through. So I went to the National Fire Academy in my early career and took the Advanced Leadership Issues in EMS course in the early 1990s before I even moved to Colorado. And it was one of the most profound and like really amazing experiences in my career, because they really do a great job, the National Fire Academy, of bringing people together from across the country. And in my class, there were a bunch of fire guys. There was a snot-nosed EMS guy. There were some state EMS directors. It was really a great experience. So
Were you the snot-nosed
I was
EMS
the
guy?
snot-nosed EMS guy.
Really?
So I mean, if it's really, if you haven't put that on the list, put that on the list. I'll also point out, I think since Rick reads into my subtext, I'll read into his a little bit too. I would say the fire service has been a long time coming and embracing EMS as a primary part of its mission. And the fact that I run a fire service organization might be somewhat reflective of that long change over time. But a lot of what they're doing right now is really acknowledging and recognizing the role of EMS in the fire service. Because I think when I was there in 1990, they were like, EMS isn't our thing, and I don't know why we have to do this. And they've come a long way from there, and that's totally worth appreciating. So I just wanted to kind of jump in and add to your comments as well as Rick. And it is funny, I'm the fire guy, and I'll stop there.
All right.
So Tim, I'll leave you with this then. Pending any other comments, as I started off with, 65% at minimum of fire department responses are EMS, no matter where you go in the country. We know that there are hundreds of fire-based EMS systems that also incorporate for-profit and nonprofit EMS systems in their 911 systems, because the volumes are just that high. But at the end of the day, 40% of all EMS responses in the United States are done by fire departments. I think that's important to recognize that, whether you like it or not, that is very well acknowledged across the industry. But I'll leave you with my email is in the chat. I've stuck it in there. If anybody has any follow-on questions, the good, the bad, the ugly, whatever. I know some of what I said creates maybe consternation and concerns. I think that's good. I think it's healthy. I think it causes discussion and progression within our profession itself overall, the profession of paramedicine. So thank you for doing what you do. And any way I can support, give me a call. Thanks for having me.
Thank you, Richard. Appreciate it very much.